and they ended up rejecting our application. And I'm like, what the hell? I'm like, I've worked for you for 14 years. I was good enough to send to China to teach a room full of doctors, but I'm not good enough to partner up. And the real reason was they didn't want to partner up with Dave because they knew they wouldn't be able to control him. Their actual words were a volatile influencer.
We welcome Dr. Adam Gavine, co-founder with Dave Asprey of Wasabi Method, the breakthrough shockwave technology and tissue longevity system that's helping people finally break free from chronic pain, regenerate damaged tissue, and reclaim high-performance health.
And she'd spent over $10,000 in 2 years and still wasn't any better. She's like, yeah, I'm still at square one. And so when she saw me and I said, look, I've had success with this condition in the past. You know, it should take 8 weeks or something. She told me later, she was like, I thought you were full of shit.
Hi, my name is Chris Burris. I'm a longevity expert and the chief scientist at a lab focused on a longevity molecule. My primary focus is to help people live longer and better lives with science. Make sure to subscribe and share so you and your friends can live longer and better, so you and your friends can live beyond the norms.
Hi, and welcome to the next episode of the Live Beyond the Norms Health and Longevity Podcast. Are you tired of nagging pain, frustrating tissue injuries, or a body that just won't bounce back? On this episode, we welcome Dr. Adam Gavine, co-founder with Dave Asprey of Wasabi Method, the breakthrough shockwave technology and tissue longevity system that's helping people finally break free from chronic pain, regenerate damaged tissue, and reclaim high-performance health. I met Dr. Gavine at JJ Virgin's Mindshare event in Scottsdale, Arizona. I got to experience the Wasabi Method and do a brief interview, and I was so impressed with Dr. Gavine's knowledge and the Wasabi technology that I wanted to have him on the podcast. A little bit about Dr. Gavine. Dr. Gavine is a chiropractor with over 16 years of clinical experience, specializing in sports rehabilitation and advanced tissue health therapies. He co-founded Wasabi Method with Dave Asprey, as I mentioned, a forward-thinking health tech and education company whose mission is to bring radial pressure wave, sometimes called shockwave, technology into the hands of practitioners and individuals as a regenerative, non-invasive solution for tissue aging, chronic pain, and longevity. His goal is to pioneer accessible education and empower people to optimize their tissue health for long-lasting vitality. Hopefully, we can help them with that goal today. Dr. Gavine, thank you for joining us today.
Thanks, Chris. Thanks for that warm welcome, and I'm glad to be here.
All right. And we had a great interview before, so I'm excited to dive into here and get some more details. But before we jump into your area of expertise, I always like to go further back, much further back. What was it like growing up little Adam? Where did you grow up? What were your parents like? If there was some event or someone you could pinpoint as the reason you would ultimately become a wellness pioneer and entrepreneur, what or who would that be?
Okay, that's a good question. So I grew up in Ontario, a place called Barrie, which is about an hour north of Toronto. I'm the youngest of three. I have an older brother who's 6 years older than me, and an older sister who's 4 years older than me. So I was always the little pain in the butt brother running around chasing after my siblings, trying to be like them. But where I grew up, luckily we had a good amount of snow, so I was introduced to lots of sports early on, like ice hockey and skiing, swimming. Like I pretty much did everything, and again, I was just following my brother and sister's footsteps. So I just, growing up, we were one of those families that went to tons of sports all the time. And now I ask them, because I have 2 kids, and I ask my parents, I'm like, how did you do it with 3? Because like 2, the math's easy. It's like the wife takes the one and the husband takes the other. Whereas when there's 3, it's like, what about the third one? And they explained to me that once my brother got old enough, he tend to go with his friends. So his friends' parents would take him because, he was, when I was 6, he was 12. So that he was old enough to kind of go off with the others. But I had a great childhood. It was lots of fun growing up in Ontario. And it's it was really hard to watch the Blue Jays lose in the World Series there when they were so close.
So
Oh,
close.
it was really hard to watch, but yeah, but that's the way it goes in
And
sport, right?
yes, it does. And so any indication kind of as you were growing up of kind of going into the health space of becoming an entrepreneur?
Well, there was kind of two things. My sister studied human kinetics at the University of Windsor, and she was a very good athlete. She actually ended up being an Olympian and competed in the Torino Winter Olympics for Canada and the bobsled. And so I kind of followed in her footsteps and went to Windsor as well because they had a really good athletics program, and we both competed in track and field or athletics. I was a decathlete, so like Daley Thompson or what's his name? I'm blanking now. The Kardashians. What's the
Yeah, yeah. Bruce
uh,
Jenner
Bruce Jenner? Yes, he
on the
won the
Wheaties
decathlon.
box. I remember that very well.
Yeah, yeah, yeah. So he was. I think that was. Did he win in '76? I think it was the Montreal Olympics he won. But anyways, that's what I did. So 10 events over 10 days, or sorry, 2 days. And you know, it's often regarded the Olympic champion is often regarded as the healthiest or most well-rounded athlete in the world.
Very cool. And that was your focus. Excellent. How about
Yeah.
any sort of entrepreneurship in the background?
Well, what I was alluding to is when I was in grade 11, I tore my hamstring because I'd learned pole vault, and when you learn pole vault, if you don't plant the pole straight overhead, if you're off to the side a little bit, it causes you to go laterally, and I
Mm,
missed the mat and fell from 9 feet onto the ground essentially.
yeah.
And even though I was young and healthy, that it actually put my pelvis out of alignment, and that put a lot of so if your pelvis goes anterior, it really puts a lot of strain on the hamstring. It lengthens it, so even if it's half an inch, it's that can lead to a lot more forces going through that tendon. And I ended up tearing my hamstring, and I was seeing a physio for about 6 months, about twice a week, and I just wasn't getting better. I still couldn't run. It hurt every time I ran. So one of my teammates on my track team said, "Oh, come see this guy in my town," which was a town next to mine, about 20 minutes away. He works with Olympians and he's really good. And I was like, "Oh, okay." And I'd never seen a chiropractor before, so I was like, "Okay, well, I'll give it a go." So I go and see this chiropractor. His name's Dr. Larry Bell, and he's in Aurelia, and he does some tests on me and on the first visit, and he had me stand up, and I lifted my knee up to 90 degrees flexion, and he pushed it down with two fingers, and he goes, "Oh, that's the same problem as Linford." And I'm like, "Who's Linford?" And he points up on the wall. There's a picture of him with Linford Christie, the 1992 Olympic champion, and it says, "Larry, you're the man," on it. And
That's
this is
when you know you're in the right hands, right?
yeah, and this was in 1995. So Linford was still the Olympic champion. So I'm sitting there gobsmacked, and I'm like, "Holy crap!" And he's like, "Yeah, Linford had the same problem." And I was like, "Oh wow." So then he assessed me and found that it was my adductors that had a lot of scar tissue, and my adductor was sticking to my hamstring, and so they couldn't. So I tell people basically that your muscles, I should be able to go in between your muscles like your fingers. So imagine if
Mm,
my middle finger was glued to this finger. Now when I go to bend this finger, they both bend.
mm.
Now the hamstring and the adductor muscle have different lines of pull, and they do different things. So if they're stuck together, they're going to affect each other. And so he got in there and broke up all the scar tissue in between them, and fixed my pelvis and got it realigned. And after my second visit, I said to him, thinking, "Oh, it looks like I'm doing well." I was thinking, "When do you think I'll be able to get back running?" And he looks at me funny, and he's like, "You can go for a run tonight." And I'm like, "Bullshit." like you might be good, but you're not that good. You can't get me better in like 2 visits. And so I went home and I went for a run that night, and that was the first time I was able to run without pain in over 6 months. And
Wow.
I couldn't believe it. From that, like, I was just like, after that, I was like, I want to be like this man. From that moment on, he became my mentor, and I knew my path was chosen. And that was luckily for me, that was at 16 years of age. So I knew early on exactly what I wanted to do.
So you kind of answered my next question, was like, how'd you end up in human kinetics, which you really have covered that. So I guess what I would ask is, how'd you end up in Sydney for your master's in chiropractic? I think that's where you got your or your PhD. Maybe it was your PhD.
I haven't done my PhD. I have an undergrad in human kinetics from the University of Windsor, and I have a master's in chiropractic from Macquarie University here in Sydney. And I'm actually doing my master's of research currently at the University of Sydney. So I'm looking at biomechanics, specifically overuse injuries, running gait retraining for people with lower limb overuse injuries.
Okay, so how'd you end up in Australia from Canada?
So I actually applied to there's only one, well, there's two chiropractic colleges in Canada. One's a French one in Quebec, and one's in Toronto. I didn't, even though I speak French, I didn't want to, because I'd studied my undergrad in English. I felt more competent in English, so I wanted to go to the English one. And I applied. The year I applied, there was 1,500 applicants, and they only accept 150. So there's 90% attrition. And I remember some of the people I applied with, because you had to go for an interview and stuff. Some of them had, like, after university, they had like master's degrees. Some had, worked in the industry as, kinesiologist or massage therapist for years. And, I just felt really inadequate compared to some of these. And I didn't have the greatest marks. I wasn't a straight A student. I was one of those ones that had to work. It didn't come easy, so I had to put the time in, and it wasn't. I don't have a photographic memory like some people, so I had to work for it.
So you ended up applying also in Australia,
Yeah, so I
and
didn't
that.
get in. I didn't get into CMCC in Toronto, and then I was like, okay, what am I going to do? And then I looked at going to the United States. At the time, with the dollar exchange, it worked out to be quite a bit more expensive for me to go to the United States. So I looked into going to Australia, and the conversion was actually better. Like, the Canadian dollar was worth more at the time. So it worked out to be, I think it was about $100,000 cheaper for me to study in Australia.
And then when did Wasabi, the radial pressure wave technology, like come onto your radar, and you decide to go down that path?
So I graduated from university in Australia. I think it was 2006, and I worked in Western Australia for about 4 years, and I came back to Sydney. And the sports chiropractor I got a job with, he got a Shockwave device, and he basically showed me how to use it. And I started using it with clients, and started really noticing some tremendous effects. Like, I thought I was good with treating things like tendinopathy, which is, people, it's a proper term for tendinitis now. Tendinitis is no longer an appropriate term, because itis infers that there's inflammation. And when you look at the tendon under a microscope, there's actually no inflammatory biomarkers. So it's a bit of a misnomer. So now we say tendinopathy. But you get, I was getting way better results using the device on top of all the other things I was doing. So it's never meant to be a standalone therapy. It's pretty much always used in synergistically with other modalities.
So from the little I understand, would that have been a good technology to help kind of separate your adductor from your, was it quad, was your hamstring from your
Hamstring, yeah.
hamstring, or is
Yeah,
that
yeah.
how did he do that at the
Had
time?
Dr. Bell had that device, he could have used that. So it's more
Mm,
like he still got the result using manual therapy, but he could
mm,
have. What the thing is, if you don't have the manual therapy skills, so say you're a physio and you haven't done a myofascial release, like I can show those physios how they can and essentially do myofascial release using the radial pressure wave device.
excellent. And
So it saves you from
I,
having to, because it takes a really long time to become proficient at doing ART or myofascial release. Like people think when I kind of laugh when new grads go like, "Oh, I know that." And that's like that's like saying you're like a 3-star Michelin chef after you graduated cooking school, you know? It's like, no, you're not. It takes years, decades really to become good at it.
And that's really kind of that manual manipulation of the, and I guess it was the fascia that was attached to each other. Just briefly, what is the fascia, and so that people listening can understand.
So fascia is actually they need to rewrite a lot of these books that say skin is the largest organ, because fascia is actually the largest organ in the body, because
Mm,
we have multiple layers of it. So think of the body like a Russian doll. So we have a superficial layer of fascia just beneath, I think it's just beneath the fat. So you have skin, and then you have fat, and then you have fascia. Okay. So fascia is like, think of it like if you buy sausages, it's like the skin around the sausage. And they used to think that fascia was not really useful. It was more like packing tissue. Now they've done, there's a researcher from Germany, Dr. Schleip. He's got an amazing book. If you want to, if you have trouble sleeping, this is a great book to read, because every time I read it, I get through like 2 pages and then I pass out because it because
I
it's
thought you were just going to give a sleeping book
yeah, yeah,
advice,
yeah.
and you're like a book that will put you to sleep.
Yes, guarantee, like guarantee.
It's a
And
great
I'm a
sales
bit
pitch.
and I'm a bit of a nerd, so I usually like this stuff, but it is so intense with the physiology and biology that you just like, whoa. But anyways, if you're really into that, it's Dr. Schleip. His book is amazing. But what they've shown is a couple things. Is that fascia actually has contractile properties.
Mm,
So it's a really cool tissue, because they found with elite athletes, they actually really, really utilize the fascial system to generate force, because it's
mm,
free, right? You don't, it's like a spring. So think of it like a slinky. When you compress it, it gives you free energy, kinetic
right.
energy. And so fascia works the same way. When you load it, it will release, but there's no metabolic cost associated with that. Whereas when you contract a muscle, you're always using ATP to pay for that. So they found that really elite athletes, they maximize their fascial system to get this essentially free energy. So they won't tire as quickly, especially like you look at like endurance events like marathon or ultra marathons and stuff. They get free energy, so they're gonna tire a lot less quickly.
Is that associated, and maybe you're familiar with this? I was having some calf cramping problems, is how I described it, and I went in, and an orthopedic guy was like, "You might have muscle compression pressure disorder, something along those lines, where it was building up in like little segments." And I'll just finish this story quickly. He was like, and
Yeah,
I was like, "How do we
they call it
tell?"
compartment syndrome.
Compartment syndrome, right?
Yeah.
Is the fascia the compartment, or is that a different muscular
Well, the fascia
artifact?
creates compartments,
Yeah.
so it separates things.
Yeah.
right?
So basically, is one kind of segment of fascia in the muscle was building up pressure, and that was his thought process. By the way, I was like, how do we figure out what's causing this? He goes like, we get you on a treadmill and we stick a rather large needle into your calf,
Yeah, it's
and
not fun.
and I was like, and what's Plan B? Because I almost don't
Yeah,
even care what Plan B is. I would rather do Plan B. So
yeah,
anyway, it ended up like stretching and deep tissue massage. I have to do it constantly, but really manages that problem. So you've got this fascia. We're learning a lot more about it, and your pressure wave technology can help with fascia release, I'm guessing.
yes. Hmm.
Excellent. So how did you come up with the name Wasabi? Because I have to tell you, my son and I love wasabi, especially when we can get our hands on the real stuff, because the real stuff is a lot stronger. Pretty powerful name. How did you come up with it?
Well, the it kind of boils down to the physiology, and the physiology is when you eat something hot and spicy, you feel that at first it kind of hurts. It's like it burns your mouth. Then after a while, you get like this numbing effect where you're like, I can't feel my tongue a little bit, and I can't really taste anything. So that's due to a process called neurogenic inflammation. So when you have sensors in your tissues that when you stimulate them, that they're pain sensing nerve endings, and these nerve endings called nociceptors have a chemical inside them called substance P, and substance P is actually it's causes pain. So it sends a signal to your brain that says, hey, this is, as we know, or hopefully people will know after I explain it, is pain is only made in the brain.
Hmm.
So if I put a knife in my hand, from my hand to my brain, all my hand is saying is we perceived a threat. And then your brain assesses the threat, and then goes, is this a problem?
Hmm.
Is this going to lead to problems? And your brain assesses it and goes, well, we're going to, there's a potential we could bleed to death. There's a potential of infection. All these things that probabilities. And then your brain goes, yeah, that's a problem. And then it sends a signal back down, which causes pain.
Hmm.
And as we all know, pain's a great motivator. So
Yeah.
if someone stabs you in the hand, you're not gonna sit there and be like, oh, I'm just gonna finish my lunch and have a talk to my friend, and then maybe I'll do something. It sends you a strong pain signal, which forces you to take action.
Hmm.
So pain, I always tell people, pain's a good thing. It's your
Yes.
body trying to tell you there's a problem. There are some times when the pain system can get carried away, and then you end up with these chronic pain syndromes, like chronic regional pain syndrome. What are the other ones? I'm thinking I'm blanking here. It's like chronic
Probably
fatigue.
fibromyalgia,
Yeah,
right? Like, is that?
fibromyalgia, all these ones. So they're when the system's having some errors.
Hmm.
It'd be like your car alarm going off when someone comes within 20 feet of your car. Like that's you don't want that. You
Yeah.
want to go off when someone touches your car, is trying to open the door, right? So that's what happens with the pain system. But going back to what I was saying with the substance P, it sends a pain signal to let you know something's hurting. But your nerve only has a certain reserve of this chemical. Once it's depleted that reserve of substance P, it actually causes a local analgesic effect.
Hmm. So it goes numb.
So kind of like when we ate the spicy food, right? It goes numb. But I can do that almost anywhere on the body. There are a few exceptions, which we'll probably go through later. But so I can instantly, well, not instantly, after I apply the radial pressure wave, I can, within a minute or two, I can create a local analgesic effect, which will
Mm.
bring down the pain. And then oftentimes it will blunt this neurogenic inflammation. It'll stop that process. So there's different inflammatory pathways. This is one of them. There are other ones like the COX-2 pathway, which is what occurs when you take like ibuprofen.
Mm.
Non-steroidal anti-inflammatories, they work on the COX-2 pathway. So the beautiful thing about the radial pressure wave is it's working on a slightly different pathway. So it can actually work synergistically with other modalities that work on other pathways, and then you get a much greater effect.
Is that analgesic effect something that you take advantage of kind of in therapy? So one, so that maybe, I know you tend to ramp up, and we'll get into how you use the device. So you ramp up as that analgesic effect comes in. But then also I have to imagine that, like in your case, when you were separating kind of the adductor muscle from your quad, that was painful. That had to be extremely painful. Do you use this radial pressure gun to create some analgesic effects so then you can get in there and manipulate things?
Yeah, that's one way you can use it is
Interesting.
but often when I do that, I don't have to use my hands after, because we get a depth of penetration with the device. So with the radial pressure device, we get about 2 inches worth of penetration. So you can get down, and I can actually reach some spots that I can't quite reach with my hands, or because when I'm pushing through tissues, the deeper I have to go, the more pressure I have to apply, and the more pressure I have to apply, kind of the more it compresses the superficial structure. So I can kind of, if I push too hard, I can actually damage the superficial structures
Mm.
to get down to the bottom ones, and that can be a problem. You can cause bruising and pain. But with the radial pressure wave, it works on the lower tissues as well without damaging the superficial structures. So that's one of the big benefits of it. So sometimes I'll be working on people and I'll be like, look, I can't quite get to the spot I need to with my hands. So I'm going to use the shockwave or radial pressure wave to get there. And also it's usually much faster. Something that might take me 5 minutes to release manually might take me like 30 seconds or a minute with the device. So it's more efficient.
Are you focused on getting the technology out there, or are you also seeing clients still? Where does that sit?
Yeah, so I see clients here in Australia daily, but
Mm.
I also run
Yeah.
Wasabi Method. So I'm busy, and I'm also doing my master's of research, and
Yeah.
I'm also an advisor to health AI app too. So all my friends are like, why do you do this to yourself? You know, I wonder why I'm stressed. And then I write down all the things I do. And, and then I'm like, okay, that's why.
And you are also chauffeur to one of your kids, right? Like if that's how the
Oh
math
yeah.
works.
Yeah. I've got two active boys. So they're, I'm always taking them to sport and school and stuff like that. So yeah, that keeps me busy.
You are super busy. All right, so let's talk, kind of break it down, talk about this technology. So you have this experience, it was very effective. You start training under the guy, and then how do you decide that you want to start bringing this to market? Obviously it was available to some degree when you first were exposed to it, and then you're like, hey, it's just somebody's not pushing it forward fast enough, or what was that driver?
Yeah, that's a good question. So when I first started working for that sports chiropractor in 2010 in Sydney, he the salesperson for the company of the device that we were using, which is one of the biggest shockwave therapy companies in the world, he approached me and said, "Hey, I see you're quite interested in this." And he was Canadian as well, so we always congregate together when we're overseas. So he was like, "Hey, would you be interested in becoming an instructor in this?" And I was like, "Oh," and the course was in Malaysia, so I was like, "Oh, free trip." It
Yeah.
was more about the free trip because I wasn't I didn't I was just moved to Sydney, so the funds weren't flowing in yet.
Mm.
So I was like, okay, I'll do this because I want the free holiday. So I went there and yeah, I was quite impressed with the technology. They showed us also they had a focus device, and so I'll explain. Do you want me to explain that now or come back to it?
Yeah, please. Yeah.
So the focus shockwave devices, they're an older technology, so they came around first. They've been around since the early 90s for musculoskeletal treatments, and they have a much greater depth of penetration. So they get up to 10 centimeters, which is about 4 to 5 inches. So you can get really deep structures, which is handy if you have like a really large client. So if I'm working for an NFL team and I've got a 6'5", 300 pound, you know, O lineman, then my 2 inch penetration with my shockwave isn't gonna quite get to some of his deep muscles.
Mm.
So it's beneficial for that. Other things, like if you're working with urology problems, so if you want to work on bladder or prostate, things like that, or you can actually use it for non-union fractures. So someone's got like a neck of femur, like hip fracture. You need to get right down to the bone to actually cause the physiological changes to make it heal. And the focus device it's more intense. It has a higher energy, and the energy creates greater physiological changes in the tissues they're applied to. So I just tell people they're slightly different tools. It's not that one is. A lot of companies, unfortunately, promote that the focus is better. They're
Mm.
like, it's the Ferrari of shockwaves. And I'm like, well, do you need a Ferrari to drive 10 miles to work on a 40-mile-an-hour road? You know, you,
I
you
think the
really,
answer is yes.
yeah, yeah. Well, it's going to cost you. It's going to cost
It's
you.
not practical.
Yeah, yeah, yeah. So, like this one company, I'm not gonna mention them, but for their device, the maintenance alone, I did the math on what it would cost me in my clinic per month, and it was $400 a month just for the maintenance of because every time you use, because there is a electrohydraulic focus device, and you have to create a
Mm.
spark. Every time you create a
Oh, wow.
spark, it degenerates more and more and more until it's done, and then you got to get a new spark plug essentially, and they're $400 each. So with the radial pressure wave device, we it's pneumatic. So we have a compressor that pushes. It's basically a gun. It has a bullet inside. It hits the tip here because it has compressed air that pushes that bullet. The bullet travels about I think it's about 90 kilometers per hour, which is maybe 60 miles an hour. It hits the metal tip. That metal tip creates these acoustic sound waves. So think of it like if I stood you in front of a big Chinese gong and I hit that really hard, you'd feel those sound waves hit your body. Yeah.
Mm.
So that's how they're created. So they're just different. We're using
Describe that again.
physics to create these
Just to
sound
describe that
waves.
again, right? So just to describe that again, you've got a barrel.
Yeah,
It's got a plate covering the end of it, and
correct.
then you're using high pressure to launch a projectile at that plate.
Yes.
And then when it strikes that plate, then that's creating acoustic sound. That's the sound that's penetrating into your body. So it does look. I've used
Yes.
you did a treatment on me, and it looks like a gun. So that's a really good analogy.
Yeah. So these sound waves, when applied to tissues of the body at certain intensities, are destructive. So the original technology was used called lithotripsy, And lithotripsy is used to break up kidney stones. You can also break up like gallstones and stuff with it too. But these are high energy shock waves. So we kind of break it into categories. There's high, there's medium, and there's low. So musculoskeletal shockwave, we're in the medium to low energy. So when you use high energy, it's catabolic, it breaks things down. When you're in the medium to low energy, it's actually anabolic, it causes healing and repair of the tissues. So it all works through what's called mechanotransduction. So mechano meaning mechanical, transduction means transmission. So when we put the sound waves into the tissues, it's basically telling your body, clean up on aisle 5. And your brain will secrete all these different enzymes and growth factors and things like fibroblasts, which will, like, are repairmen basically, and it will send them down to that area to kind of clean up the mess. So with the medium and low energy shock waves, it causes this healing reparative effect, and with the high energy, it causes breaks things down. But that's a separate category. That's lithotripsy. You actually have to be put under when you have that done, because it would be excruciating to be awake with when they did that.
When you think about, one of the ththings that comes to mind as I was kind of preparing for this interview is when you're doing, what is it called? A derma roller, where you're actually kind of penetrating the skin and causing a small injury. And then when your body goes to repair that very small injury, it actually ends up, the way I describe it is like, aisle 2, we got to clean this up because there's a small injury. Also, the shelves are in disarray. So while we're here fixing the important thing, we're also going to put the shelves in order. Is that kind of what's going on, or is that?
It's a similar effect. It's actually causing some inflammation, but acute inflammation is actually beneficial, and they're actually showing, like, the recent studies have shown, like with ankles, you actually don't want to put ice on it straight away. It's the inflammation is bringing in, it's a chemotactic effect. So your body's sending all these repairmen to the area, to the macrophages and the phagocytes and all these white blood cells and stuff to clean up the mess. So when you decrease the inflammation, you're reducing the number of cells that are there to help clean up the mess, right? So that's what they've shown in recent studies, is actually it helps with pain, but it actually prolongs the healing process. So if you didn't use ice on your ankle straight away, you're actually going to heal faster.
Yeah, I never understood that. It never made sense to me to ice and like, inflammation is your body's response to the damage, and unless the body is making a grave error, which it doesn't do very often, it certainly does in some cases, right? There overreactions.
That's usually, as I said, like with these, like fibromyalgia, where there's an error.
Yep.
There's a systems error, and that's why that's happening, and that's not a normal response.
Yeah.
Yeah.
So yeah, I've never. So we're doing some, and in one interview you kind of mentioned cavitation. For me, cavitation went directly to, like, something that you typically want to avoid, right? If you think about a ship or a submarine, they're often worried about cavitation because it'll actually damage the propellers. Is cavitation the thing that's kind of creating some damage in that area that is then getting the body, eliciting a response?
Yeah, no, that's a good question. So cavitation, as you were alluding to, it depends on the energy. So similar to shock waves, if you have really high energy, it's going to damage things. If you have lower energy, it actually stimulates mechanotransduction in a way that heals and repairs things. Yeah. So the way it creates these cavitation bubbles is, so think of it like pressure is on the horizontal axis, and then we have time. Or sorry, I got that wrong. So we have pressure on the vertical axis, and we have time on the horizontal axis. So when we create these shock waves, they create pressure changes in the tissues, and this is what causes these cavitations. So you have the first phase is called a positive compressive phase, so it's above ambient pressure. And then you have the following phase is the tensile phase, which is a negative phase, so it's lower than ambient pressure, and that creates these cavitation bubbles. It's the delta between the two pressures. The change between the two pressures creates these cavitation bubbles. And then what happens is the following shockwave compressive phase kind of hits these, and then they release energy. They call them microjets. And then these microjets cause the mechanotransduction, which stimulates the body to release all these repairmen and cause the healing of the tissue. So that's kind of how that works. So if you think of the way it had explained to me once was basically, if you're on like a trampoline, so you have the trampolines here, and then you jump on it and it bends, but then when it comes back up, if that was the original height, it actually goes a little higher. Okay, so that's what happens with the compression phase. So it compresses it, and then when it rebounds, it actually goes a little higher, or in this case, it would be lower than if you flip the trampoline upside down.
Yeah,
How the curve would look. Does that make
And so
sense?
causing that kind of small cavitation is pretty powerful. That's enough, again, to kind of at a minimum, irritate the zone, not actually do damage that's kind of long lasting, but small irritation / damage. And now your body sends the proper inflammatory response in order to heal that area.
Yeah, it's
In addition, go ahead.
It's really about, when you really start to understand physiology and how the body works, it's really all about inputs and outputs. So I put these shockwave into the tissues, which it's an input. And then my brain, through mechanotransduction, so I'm putting these shockwaves in, it's saying, hey brain, do some stuff. Send the repairmen, send the firemen, send the electricians, send the plumbers, send the carpenters down here to clean up the mess. And then your brain goes, okay, I'll send them down. So that's an output. So that's really how most things work. And it's the same like if you take a drug. It's an input, which causes an output. Right? So that's, if you can understand the body as inputs and outputs, it makes a lot more sense.
Hey, super quick break from the podcast. Hopefully you're loving it. This is a way you can support the podcast and take advantage of a great offer. We're offering 50% off of one of our MCT bottles. MCT is an amazing oil. Add the ESS60 molecule to it. It's even more amazing. All you got to do is leave a review on iTunes. Send us a notification that you've left that review. We'll get you a coupon code that'll get you 50% off of our MCT oil and free shipping. Back to the podcast.
Okay, so you go to Malaysia for this training, and then you get trained. So walk us through kind of when you decide that this is something that you need to bring to market.
Okay, so I worked for that company, one of the biggest shockwave companies in the world, for about 14 years. So I learned a ton. They would fly me around Southeast Asia. So I went to China, I went to Korea, I went to Indonesia, I went to Thailand. And I taught throughout Australia for 14 years. So I kind of learned everything I could about the science and the technology. So they had a new device that they'd got FDA approval for to sell in the States, a radial shockwave device. And I was really, because being Canadian, I have connections and stuff over there. And so I knew Dave Asprey, and so I brought the device over and I showed him, and I was like, oh, this is really cool. You should check it out. We're getting FDA approval. I think I met him in like September or something, and the FDA approval was supposed to be in December. They didn't end up getting it then, but we were trying to make things happen really quickly. So Dave, after I showed him the technology, he contacted me a few times after and was like, I like this, I'm interested in doing something together. So we're like, okay, we were just going to set up like a shipping, receiving, and be like a distributor for this company. And so we sent them a business plan and all this, and they ended up rejecting our application. And I'm like, what the hell? I'm like, I've worked for you for 14 years. Like, I was good enough to send to China to teach a room full of doctors. I did 7 cities in 7 days where I taught at 2, like hospital or university. I went to 14 hospitals or universities. And I'm like, I'm good enough to do that, but I'm not good enough to partner up. And the real reason was they didn't want to partner up with Dave because they knew they wouldn't be able to control him. And that was the real
Probably
reason.
an accurate assessment.
Yeah. So their reasoning was, we don't want to partner up with their actual words were a volatile influencer. And I was like, okay. So then we actually approached their direct competitor. So like the number 2, arguably number 1 or number 2. It's like Lamborghini and Ferrari. So we went from Ferrari to Lamborghini, and then we said to them, same thing. Well, we gave them a business plan and all that. And they were like, oh yeah, this sounds great, but you guys have no sales history. And we're like, well, how are we supposed to get sales history if we don't get an opportunity? I'm like, can we have, 6 months probation where we can show you that we can make sales? And they're like, no. And I'm like, okay. So now I was really stuck. I was like, oh my God, this didn't go to plan. So, because when you make plans and you're like, you foresee how everything's
going to happen.
Yep. And so all my plans were flushed down the toilet, and I'm like, I don't know what the hell to do now. And then I had a friend introduce this other device to me, and he was like, hey, this guy's, got this device, maybe talk to him. So we talked to this other guy, and he was very happy to partner with Dave, and he saw the opportunity and was like, hell yeah, I'm in. And it worked out much better because we had autonomy. The big companies, there's no way they would have allowed us to do what we would have had. No autonomy. They would have just been like dictating to us what we could do, what we couldn't do, and it wouldn't have lasted. So this is the way it had to be. And it allowed me to create all the education that accompanies the device. And that's one of the big things that separates us from our competitors.
Very cool. I love how businesses actually come together often.
Yeah. It's often due to necessity. It's like, I had no other choice.
Yeah, we still want this project to move forward. This is now it's got to go a different way. So what are the different kind of healing processes? I've heard some interviews. Where is the Wasabi effective, right? So we've talked about kind of this physiotherapy realm, but I think it's much bigger than that.
Oh yeah, well it's there's actually 19 physiological effects that it causes on tissues. Some of the big ones are, as we alluded to earlier, is the analgesic effect. So you can get an instantaneous change in people's pain perception in a localized area. So so the way pain works is pain's very unpredictable. So if someone has like tennis elbow, for instance, I could have 10 different patients with tennis elbow, and their movement pattern when they do, wrist movements will all be different, even though they all have the same condition. So I took this from Greg Cook. He's a very influential and super smart physio from the States. And he says pain is unpredictable. And when you have pain, your brain kind of does different things to it will compensate to get away from or to minimize the pain. And it will present differently in every single human being. So if I can diminish or get rid of someone's pain, then I can restore normal biomechanics, right? So if I'm training someone to have good biomechanics, I really can't have them in pain because they're going to compensate. So they essentially can't move normally because their nervous system's going, no, I can't do that. Right. So if we can alleviate or create an analgesic effect, then I can restore normal biomechanics. Then I can train them so that they'll have these proper movement, what we call motor programs. So think of like when you sprain your ankle, right? You don't decide to hobble. You don't go, oh, it's a good idea that I hobble, and if I sprain my right ankle, I'm going to load up my left ankle so that I have less force going through my right ankle and it's going to hurt less. You don't think that. Doesn't matter how smart or how dumb you are. Your brain just goes, it's an autonomic subconscious thing. Your brain just goes, adapt, do this, less pain, right? So when we can get rid of the pain, then we can go back to conscious, like volitional control of the joint. So then it's the opportune time to train people because they're going to have the proper biomechanics, and that's going to train that engram or motor program to work properly again. So often I'll work on people and then I do the rehab straight away because it's the best time. It gives me a little window where I can actually train them more effectively.
Okay, so that you said there's 19. What are maybe one or two more kind of areas where it excels?
A few other ones are it causes a proliferation of fibroblasts. And so fibroblasts are kind of like little repairmen of the body. They clean up messes, and they also create collagen. And we all know how important collagen is for the body. So you can have increased collagen production by increasing the fibroblasts. You also have one of the big effects is what's called angiogenesis, which is the new formation of blood vessels. So when we talk about improving blood flow to a tissue, it's not just like when you put heat on something, you cause proliferation and dilatation of blood vessels, which brings more blood in. But that's a temporary effect. What I'm telling your body to do is lay down new capillaries in that area, which is a permanent change. And so for a lot of injuries and musculoskeletal related problems are actually really due to blood flow. We have an injury to an area and it restricts the blood flow. You get scar tissue in there. It causes a restricted range of motion. Also, because of the restricted range of motion, our brain has a 3D map of our entire body. So think of it like an app. If I don't move that joint in certain ranges because I have pain or restriction, the 3D map or representation of that joint gets kind of blurred. Yeah? So when we can update the app, we're making the picture, the 3D map, much clearer. We're improving the resolution. And then the brain goes, oh yeah, I can move there. I can control that now. So it's the neurology comes into it really profoundly. But the blood flow is hugely important because that's going to help get energy to those tissues so the muscles can contract better. It's also going to help with byproducts and toxins and stuff from creating energy, so we can take that away. So we take the garbage away and we bring the healthy oxygenated blood to the area.
So you mentioned scar tissue, like we're picturing, because we're talking physio, internal. How about kind of surface scars? Any impact? And I know in one interview you mentioned cellulite.
Yeah. So with scars, we can pretty much get rid of them. I have a patient that I'm actually seeing tomorrow, and she had a hip replacement, and then when she was doing rehab, her hip fractured, so they had to go back in, and it was
Wow.
because her bone density she was on this medication to help her hormones, and it made her bones really fragile,
Brittle.
unfortunately. Yeah. It's not very common to have that, but she was like the 1 in 100,000 or whatever that get this. So the surgeon had to go back in and he basically cut her. She has a scar, if you can see my leg, that goes like from her knee all the way up to her hip.
Wow.
And it was pretty thick and tight and very, very tender. And I've been seeing her for just about a year now for that. And I remember telling her when I first started seeing her, I said, we're going to get this scar so that it'll just be like one like small line on there. And she was like, no way. I'm like, yeah, you watch. So it breaks down the scar tissue in the actual scar. And I can actually feel it, because when I palpate, because I've touched so many bodies, I can feel what's normal and what's abnormal. And so at first I'm like, this is really stuck. And it's really about the skin. Like if you see, my skin on my arm, I can move it up, down, left, right, round and round, clockwise, counterclockwise. So that's kind of indicating how functional that is, and that will indicate like layers beneath, like the fascia and all that, how that's moving. If that can't move in every direction, that's usually there's either an adhesion or some kind of scar tissue in there that's blocking that. So we can fix that with you can either do manual therapy or you can use the radial pressure wave therapy. I find with the radial pressure wave, it's just way faster. Like I can get a lot more, like if I had to do that all by hand, it would take me like half an hour to do her whole leg, where I can do it in like 3 minutes using the Wasabi.
Wow. And how old is she? Because I think that's relevant. You're usually not getting...
She is, I think she's late 50. I think she's 59.
Okay, so yeah, right, early but not young, right? Which is painful for me to say since I'm 56. But yeah, so she's of the age where scarring tends to take a lot longer to heal, and you're healing it in 12 months. That's pretty fantastic. You had one other testimonial I want to get to that I think was really important. And then I want to get into our wrap-up questions, which was about a lady with plantar fasciitis. One, I like it because I have plantar fasciitis, and so I've got to constantly be aware of like how my feet are when I'm sleeping, because I want to be in an extended, have my calves extended. But talk about that one testimonial, because I think it was really powerful.
Okay, so I still see this client, but for other things now. But she had, I used to work for an orthopedic surgeon who did hips and knees. And this patient in particular, she'd actually been injured by a chiropractor years ago. So she was kind of like, I don't go to chiropractors. And then the surgeon was like, Adam's really good. He'll take care of you. And so when she came to see me, she's like, I'm only here because Dr. Almadiris told me to come see you. And I was like, okay. And she's like, I've had this for 2 years. I can barely walk. I haven't seen my daughter or granddaughter for 2 years because they're living in Hong Kong, and I can't get on a plane and walk to get to see them. So, that was, you can imagine what kind of psychological effects that would have on you on top of the pain and the disability. And she's like, I've seen about 10 different practitioners, including physio, osteopath, podiatrist, sports med, and she'd spent over $10,000 in 2 years and still wasn't any better. Right? Like, it wasn't like she got a little better and was like, oh, it's, they got me working pretty good. It was like, she's like, yeah, I'm still at square one. And so when she saw me and I said, look, I've had success with this condition in the past. It's gonna, it should take maybe 8 weeks or something before we get it really settled down. And she told me later, she was like, I thought you were full of shit. Well, she just
Nothing's gonna
expected me
happen.
to be number 11 on the list of failures.
Yeah. Yep.
So I started working on her, and again, it wasn't just using the wasabi. It's there's really 3 things I do to help clients. Is first is avoid things that perpetuate or exacerbate the condition, right? So for plantar fasciopathy, it's really about minimizing the time you're on your feet. Number 2 is do rehab that will make the tissues stronger, more functional, more resilient. The third one is come see someone like me, a body worker who knows how to work with these tissues to help restore them and make them functional and healthy again. Now, if you do all 3 of those, I always tell clients 1 + 1 + 1 is 12. Because they're exponential when you use them synergistically. Now, the beauty is 2 of those 3 things is totally up to the client. You will improve if you stop doing the things that piss it off and you start doing things that will make it stronger, more functional, more resilient. 100%. But then you add on top of that doing an appropriate therapy, and then it's just like rocket fuel. So she really listened to me, and 8 weeks later, I had her on a plane to Hong Kong to go visit her daughter and granddaughter. And after that, she sent me at least a dozen clients because she was just like, you got to see this guy. He fixed me when no one else could. So that was it's a great story, and I'm very happy and pleased to share it. And I don't sit there and go, I'm the greatest, but it just shows people that the things you can achieve if you have a good understanding of what to do and you have the right tools.
Man, no, I when I heard that story, I thought it was worth sharing again. Anything else? We'll give you opportunity to kind of how can people connect with you, but did I maybe miss anything that you wanted to touch on before we get into our wrap-up questions?
The one thing I kind of didn't touch on when we were talking about the angiogenesis is that it has effects not just for the musculoskeletal system, but also for the reproductive system. So you can work on men's sexual health and women's sexual health with this device. And we have education to go along with that. So about just over a third of our sales last year were actually non-practitioners. So lay people who have bought this for themselves. And some of them are males with erectile dysfunction, because a lot of the time, if you go to say like a urologist, they're usually the cost is between $300 to $500 US per treatment. And oftentimes you're not it's not the actual urologist doing the treatment. It's like a nurse or something that works for them. And you have to have a minimum of 6 treatments. And they also, there's a new study came out a year or 2 ago that was showed that if you have an additional 6 treatments at once a month after you've had the original protocol is 6 treatments once a week for 6 weeks, and then you do 6 treatments. The new study showed 6 treatments once a month for 6 months after that had much greater effects in the long term. So if you're thinking, 12 visits at $500 a pop, that's $6,000. You can purchase my device for $15,000. So some of these guys are like, well, I'm just going to buy one and then I can use it whenever I want, and then I don't have to rely on these urologists to fix me up. Not only that, but they can we can't say treat, they can work on other parts of their musculoskeletal system, and and it's going to save them money from having to go to the physio or chiro or podiatrist, so it adds up pretty quick. And with the education modules, I've actually gone an extra step of making modules specifically for the layperson. So I don't use all the big Latin and Greek words, and I make it real simple so the average person can understand how to use it and do so with a high degree of success and safely. Whereas most of these other companies, like when I bought my device 15 years ago, I had a salesperson teach me how to use it. He was like, this is how you turn it on, this is how you use it, this is how you clean it, this is how you turn it off. Good luck. And that was it. And this was one of the biggest Shockwave companies in the world. And I was very underwhelmed. And so we've done all these extra steps that I wish I would have had when I purchased my device. And one of the extra steps is you actually get an hour with me, the co-founder and chief medical officer. And I'm like, we'll have a Zoom call like this, and I'll show you exactly how to do things, and you can ask me any question. On top of that, we have all the education. If you're a layperson, it's mandatory you purchase all the education. Just it's a safety thing. But yeah, it's about 600 pages worth of data. So I show you exactly how I would treat if I had, or work on tennis elbow, or if I have, I think you said you had a mallet finger or something. Yeah. So things like that, you can, I show you exactly what you need to do. So there's no guesswork involved. It's all very concise. I have really good anatomy pictures. We have videos demonstrating me showing you exactly how to hold it, how to, it's very comprehensive and I haven't seen anyone else in the field that has done this, because I've shown my education to other brands, and they're like, holy crap, like they couldn't believe the level of detail I've gone into, because it's taken me over 2 years to create this education, and it's super detailed, and that's what really makes us different, is that we give this. I actually tell people my device isn't any better than other devices out there. Right?
Yeah.
And I tell you, the education and our support is unparalleled. Like, I didn't even meet the CEO of the company I worked for 14 years, let alone have a Zoom, with him showing me how to use it. And that's the level. We're small now, so we can offer that, but that's the level of care and that's what we do.
Support.
Yeah, that's the support we offer, and that's what really separates us from the other companies out there.
I think yours is better because it says wasabi on
Yeah, yeah.
it.
Oh,
That's
it's
why.
cool. The color too. The color as well. It's the wasabi green, so
Green's
it
gorgeous.
it
All
pops.
right,
And
let's.
most of these other devices are white and black, and it's very very clinical. Like we like to have a bit of fun with it.
Yeah, well, it's high energy. It's a high energy device. It's delivering lots of value. So it deserves kind of a color of high energy. So I think it makes perfect sense. All right, let's get into our wrap up questions. Um, Dr. Gavin, do you have a target age that you want to live to?
Oh yeah, I've thought of that before, and like I know Dave says 180 and stuff. But I think you know maybe 120, somewhere around there.
Excellent.
I would be happy with. I don't think we'll be getting to 180 for a while. I think in maybe another 100 years, maybe. But it's also like the health span versus lifespan. If you can have a long health span, like I don't want to live to 120 and have my last 30 years of life be in a wheelchair and be demented and like what's the point? There's no point to
Yeah,
that. So yeah.
120. And how long do you think humans can live?
Um, well, currently, or are we talking about like in the future?
Yeah, I think you can answer it however you want.
So I think in the future it could be hundreds of years.
Mm,
Um, because if we can figure out how to get these tissues to regenerate, um, you know, you're just rejuvenating your tissues, and you'd look the same kind of forever, right? And then it'll be more like you want to be like Yoda, right, where he just goes, okay, my time's up, I'm gonna just disappear now,
mm.
right? Oh, was he 900 years old when he went?
Into the good night.
Yeah.
All right, Dr. Gavin, what are
Yeah.
2 to 3 protocols, habits, mindsets, let's call them shortcuts,
Mhm.
to longevity and long health span that you would share?
um Ones that I use currently, I've got a vagus nerve stimulator. I find that helpful. Like I drive a lot, so I'll actually be in the one I have. You hold it up on your SCM, like up here. It's called the Who List, and I have no affiliation with them.
Mm.
But if you're interested, you can look that up. But I'll be driving, and I'll have that on. You just do like 4 minutes on each side, and it just when I get home, I just find it like I can separate you have your work hat on, and then you take that off,
Mm.
and then it's like dad and husband hat goes on and stuff. So it really helps me transition from a stress mode from work to I want to be relaxed and calm and approachable to my family. So that's one thing. Also, I love going for walks on the beach. I try and do that most mornings, so I get the sunlight, so it helps with vitamin D, also helps with serotonin levels, and we know that having adequate serotonin levels leads to better melatonin at night, so it's going to help me sleep. So I make that a priority. Plus the grounding. I always go barefoot, so I'm grounding, and I get ocean connection as well. So kind of the spiritual nature connection, and I can look off in the distance because a lot of the time I'm staring at screens and reading
Mm.
stuff. So it's really good for your eyes to be looking off in the distance, so you don't become too myopic. And sorry, what was the question again?
Yeah, the third, yeah, for habits, protocols, mindsets
Um,
for longevity and long health span.
a mindset's an interesting one because I'm an optimist, and kind of no matter how bad things get, I'm always like, I always think the future is going to be better, and I don't know how to be any other way, because it's like, if I didn't think that way, I wouldn't get out of bed in the morning. It's like, if I don't think
Mm,
today's going to be a better day, then I'd just be like, oh, I'm just going to stay in bed, and life sucks, and what's the point, kind of thing. So that's I'm an eternal optimist, and thinking things, and I try and steer clear of all this media that we have just bombarding us with negativity, and like, it's essentially poison for your mind, and just it puts you into fight or flight, and like, I don't want that. So, like, I don't watch the news, and I always think, like, 5,000 years ago, if I was living, I didn't know what was happening on the other side of the world, and I didn't care, right? But we all like, oh, we need to know what's going on everywhere. Bad things have always happened. Like, we act like this is a new thing. It's not. There's been corruption, there's been murderers, there's been thieves, there's been, all these things for all of human existence. It's not something new. We just report on it more now. That's the only
yeah,
difference. But I
yeah,
don't
we
need to
see
be
it.
spoon-fed that every day. I know that stuff happens. It's actually, I
Yeah,
think it's detrimental to I don't know, what's your opinion?
100%. I don't watch the news. Anything big enough to actually be necessary to know, I find it through social media, actually,
Yeah. Well,
or
I find
somebody
I
here at the
find it
office.
from clients, like, if
Yeah,
something big happens, they tell me.
yeah. Let me bust out my radial pressure wave device, and we'll move on. What are 1 to 2 things you think people get absolutely wrong regarding longevity and a long health span?
Couple things come to mind. One is that it has to be expensive, that you got to spend tons of money, and like, I just gave you a few examples. Like, it doesn't cost anything to go for a walk in nature. Doesn't cost anything to get some sun on you. Like, vitamin D is free. You don't have to take a supplement. It's different if you have some kind of skin problem. Um, but you don't have to have all these fancy things. You don't have to have, like, I have a infrared sauna. Um, but you don't have to have that. There's things you can do that will move the needle, like, just getting good sleep. You can meditate, getting out in nature, having good clean water. Like, you might want to spend some money on, like, a reverse osmosis, or something that takes all the junk out of the water, so you're not drinking all these, contaminants and toxins. That's probably, some people are like, water's water, and I'm like, okay, well, go drink from that puddle outside on the street. It's like, if water's
Yeah,
water, that's water. And then they're like,
yeah,
oh, I'm like, yeah, so it's not the same.
yeah. Excellent. Things don't have to be expensive. All right, Dr. Gavin, how
Yep.
can people contact you?
So I'm active on Instagram. So my tag is Wasabi underscore method. I'm also on Facebook. You can email us through our website at info@wasabimethod.com. We're quite responsive, so if anyone has any questions, often it's me who will respond to you. We don't have a huge array of employees that it gets passed through, so often it's me who answers them. Um, I'm on LinkedIn as well. Yeah, and I also have my clinic website you can check out, is backtofunction.com.au, because it's Australian. And our website, we have kind of two websites. One is wasabimethod.com, and the other one is wasabimethod.store.
Excellent. And what in the near future are you excited about?
For my company or for the world?
Whatever comes to your mind.
As for the world, again, I'm still an optimist. I think things will get better. There's always cycles, and I think we're just going through part of a cycle, and yeah. So I always tell people, just keep doing your thing, and stay positive, and don't let the politics of the world and geopolitics, get you down. Because you look at history and there's always been bad stuff happening. Like I look at my grandmother's generation. She was born in 1905, so she went through World War I, the Spanish flu pandemic. She went through the Great Depression. She went through World War II. Vietnam. It was just like you're just like that. Like that was a resilient generation, man. Like compared to what we've got it pretty easy, I think, right? Comparatively, I don't know. What are your thoughts?
Yeah, no, I think very much so. All right, well, you can find Dr. Gavine, Wasabi_method. That's on IG and I think Facebook. Email info@wasabimethod.com. Website wasabimethod.com, or you can hit his kind of practice in Australia, backtoffunction.com.au, and then also wasabimethod.store. Dr. Gavine, thank you so much for joining us today.
Thank you, Chris. It was a pleasure, and I had a good time.
I hope you enjoyed this episode of the Live Beyond the Norms podcast. Make sure to subscribe and follow. Also, make sure not to be that guy, the guy sharing this podcast with people who are not interested in living beyond the norms. If you would like to learn more about the ESS60 molecule, the molecule responsible for the single longest longevity experimental result on mammals in history, a full 90% extension of life, visit myvitalc.com. That's myvitalc as in carbon.com.